Good morning, my name is Jennifer Bellin. I'm a nurse practitioner student at the University of Texas El Paso, and today we're going to be doing a musculoskeletal and a neurological exam. So looking first across the room, my patient is in no acute distress. His color is normal. His posture is upright. I don't see any involuntary movements or gesticulations or any joint deformities or swelling right off the bat. Do you have pain anywhere today, sir?
No.
Okay, I'm just going to first palpate for symmetry or any obvious deformities. And I don't feel any. Okay, beginning with range of motion, first thing I'm going to have you do is just bring your arms straight out. Perfect. And I'm going to have you bring your fingers up and fingers down. And then in and out. Then thumbs to your forefingers. And then tiny circles. Okay, good. Go ahead and resist me. Bring your arms up and flex. Resist me. And then bring them down. Good. And then big squeeze here. Perfect. And when I look at his fingers, I don't see any thickening or deformity or nodules on the fingers. Moving on to the elbows, I'm going to have you first flex and extend. And then resist me as you come up. And flex your elbows. Good. And then push me down, extend. And I'm also going to feel at the olecranon process. There's no nodules or deformity noted here. So for both his wrists, his elbows, and his fingers, he has normal range of motion. Strength is 5 out of 5 bilaterally. Moving on, I'm going to assess the anterior shoulder girdle. So if I could have you just stand up for me, please. Okay. And palpating here first. I don't see any fasciculations, any nodules. The clavicle is symmetrical. Go ahead and shrug up for me. Okay. And then I'm going to push down. Don't let me push down. Good. So normal strength. And just to test your shoulder range of motion, I'm first going to have you bring your arms out to the side, and then down, and bring them forward, and back, and then cross one across the body, and then the other, and then back over your head, and the other, and then like you're trying to reach in back. Okay, and then on the other side. So perfect range of motion there. I'm going to also take this opportunity to inspect the posterior scapula and make sure that the rise and fall is symmetrical. So go ahead and shrug up for me. And let me push you down. Perfect. So not to neglect the C-spine. So first thing, good. Just go ahead and flex at the neck. And then look up. Okay. And then turn your head to the right and to the left. And then we're going to do a lateral bend, so like you're doing your ear to your shoulder, and the other side. Good. And then I want you to just resist my hand as you come back up. Perfect. Then the other side. Good. And then if I have you just open and close your mouth. Okay. So no clicking, normal range of motion, strength is 2+ in the cervical spine. Moving forward, we're going to assess the range of motion for the rest of the spine. So go ahead and bend forward like you're going to touch your toes. And I'm going to track down, there's no step down on the spine, there's no abnormal curvature, there's convex on the thoracic spine and concave with the lumbar. The movement is symmetrical. Go ahead and come up. And then hyperextend back just a little bit. Good range of motion there. I'm going to have you do a lateral bend to the side like you're going to touch your toe. And then to the other side. Good. And then just rotate at your trunk. Perfect. So good range of motion through the spine. The next body system we're going to assess is the hips. So for that, I'll have you actually lay flat on the sofa. Okay. I'm going to have you bring your leg straight up. Good. Push against me. Good. And down. Push me down. Perfect. And then I'm going to have you bring your leg over across your body and then out. Wonderful. Now we're going to do the same thing other leg. Go ahead and relax. Push me up. Good. Push me down. Okay. All right. And bring your leg across the body and then the other way. So a good range of motion. The hip strength is 5 out of 5 bilaterally. It's symmetrical. I'm going to have you flex at the knee. So bend up. Push me away. Good. And then here we're just going to rest. We're going to do an internal rotation and a figure 4. And then push me away. Extend your leg back out. Good. Same thing other side. Bend at the knee. Perfect. And then internal rotation here. Good. And external. Good. And then straighten out your leg. Okay. So normal range of motion through there. I'm going to have you actually sit up. We'll next take a look at your knees, ankles, and feet. Okay. So go ahead and extend up through this foot, up through the knee. Okay, good. And then push me back. Okay. Same thing other side. Push me up, push me back. All right, normal range of motion. Strength is 2+. I'm going to have you bring your ankles up and dorsiflex, and then plantar flex. Good. Internal rotation, external rotation, little circles, and then curl your toes over a pole. Okay. And push me away like you're driving. Okay, and then resist me back. So he's normal with his range of motion. Strength is 2+, which is expected and symmetrical throughout all the body systems. We're going to go ahead and move on to the neurological exam. So first cranial nerve, I'm just going to have you close your eyes. Tell me what that smell is.
Cinnamon.
Perfect. Okay. And tell me what this one is.
Ooh, smells like curry.
That's right. And so olfactory cranial nerve was intact. For cranial nerve 2, the optic nerve, we're going to defer since we did the Snell and I examined the head, ears, eyes, nose, and throat, as well as the trochlear, oculomotor, and the abducens. Moving on, I'm going to assess just first facial sensations. So close your eyes. Tell me where I'm touching.
Cheek, forehead, cheek.
Perfect. And then I'm going to have you just do your, that was your trigeminals over your facial. Open your eyes. Close your eyes. Wrinkle your forehead. Okay, smile. Frown. Puff out your cheeks. Okay, so facial nerve is intact. Next one is going to be glossopharyngeal, so swallow for me. Swallow is normal. Say ah.
Ah.
Perfect. So the uvula rose symmetrically. For spinal accessory, we already did the strength exam in the beginning portion, so that cranial nerve has been checked. I'm also going to defer the vestibular because he's been able to hear me and follow commands throughout the exam, so we're not going to go any further into hearing. There's no signs of vertigo with this patient. And then last one is going to be the hypoglossal, so I'll have you stick out your tongue to the left, to the right. Okay, so all cranial nerves are intact. Next thing is just going to be assessing the mental status. He is alert and following commands throughout this exam. I'm going to ask you a question. Can you tell me how an apple and orange are similar?
They're both fruits.
And how are they different?
One is a citrus, one's not.
Okay, so abstract reasoning is intact. Could I have you count back from 100 by 10s, please?
100, 90, 80, 70, 60, 50, 40, 30, 20, 10, 0.
Okay, wonderful. So the next thing I'm going to do is test your light and dull sensation. So I'll have you close your eyes. And then tell me where I'm touching it, if you feel sharp or if you feel dull.
Sharp right arm, bicep.
Okay.
Oh, sharp right bicep. Dull left arm bicep. Sharp forearm left side. And dull right forearm. Right leg sharp. Left leg sharp. Dull left leg. Right foot dull.
Okay.
Oh, sharp left foot.
Okay, so light to sharp sensation is intact with this patient. He was able to tell me before we started the exam how cold my hands were, so he is sensitive to cold. Next, we're going to test the sterogenesis, so if I could have you close your eyes again. I'm going to place an object in your hands, if you could tell me what the object is.
A ball.
Okay. Okay. I'm gonna trace a picture in your hand. I want you to tell me what you feel.
8.
Good.
Circle.
Wonderful. So next I'm going to, with your eyes closed, you're going to feel me move your finger. Tell me if it's moving up or down.
Up. Down. Up. Down.
Okay, so proprioception seems to be intact. Next, we're going to do just the finger to nose test. So if I could have you place a finger on your nose, and then touch my finger, and to your nose, and touch my finger, and to your nose, and touch my finger, and to your nose, and touch my finger. Good, and movements are quick, accurate. Next, I'm going to have you place your hands in your lap like this, and turn them over. And I want you to continue to do that, but every time get a little bit faster. Okay, awesome. So movements are quick, symmetric, they're accurate. Next, we're going to move on and we're going to test your cerebellar function. So we're going to move forward and test your gait. So I'm going to have you go ahead and stand up. And if I can have you just walk in the direction of the camera a few steps. And his gait is symmetric, his arm swing is normal. Go ahead and walk back towards me. I want you to walk on your toes this time. Okay. And then walk back, but on your heels. All right. And then coming back this last time, I want you to walk heel to toe. Okay, so I'll expect it. Go ahead and stop there. I want you to close your eyes. Okay, and there's no sway. He doesn't lose his position, so that's a negative Romberg. His cerebellar function seems to be intact. The last test we need to do is the heel to shin. So for that, I'm going to have you actually lay back down on the sofa. And I'm going to have you, with your left foot, trace with your heel all the way up to your knee and then back down. Perfect. And then on the other side. Wonderful. And while you're in this position, I'm going to go ahead and move on to your cutaneous reflexes. Checking first the plantar reflex. I'm going to trace up the bottom of your foot, okay? Okay, and it's very ticklish, but there's no Babinski, so that's a normal finding. And if I can have you just bring your shirt up, I'm going to do the abdominal reflex next. And what I'm looking for is for the umbilicus to rise in the direction of the stimulus. And it does. All right, and the last thing that we need to do is just elicit the deep tendon reflexes. So for that, I'm going to have you sit on the side of the sofa one more time. Okay, so at the level of C5, C6, we're going to assess the biceps reflex. So flex for me here. Okay, relax down. Okay. Okay. Then the brachioradial. Have you rotate just a little bit. All right, 2 plus. Okay, look for the triceps. All right, going to move over to the other side, and that would be the level of C6, C7, C8 for the triceps. Same thing on this side with the brachial first. Good. Just have you rotate ever so slightly. Thank you. Good. All right. So upper extremity reflexes are 2 plus. They are symmetrical, which is an expected normal finding. I'm going to move down to the patellar reflex. And looking at his legs, I can see that they're symmetrical. It tracks down from the tibial process all the way to the malleolus, so that's normal. Go ahead and lift here. Okay. Okay. Other side. Perfect. And then for the Achilles, I'm going to just dorsiflex a little bit. Perfect. Other side. Thank you. Perfect. So lower extremities are 2 plus and they're symmetric, and this concludes my exam. Thank you.